I go see my patient, I'm going to check her chart and wash my hands. And knock on the door, knock knock. Hi, my name is Caitlin. I'm going to be your student nurse today, or your nurse today. Can you please tell me your name and date of birth?
Liz Colhane, 22761.
Okay, that matches your wristband. Perfect. Today we're going to be doing a head-to-toe assessment. Do you have any questions before we start?
No.
Okay, I'm going to start with a general inspection. So, patient's posture is symmetrical and upright. Her shoulders are symmetrical with one another. Her skin color is appropriate to ethnicity with no lesions or abnormal nevi or deformities. She does have one bandaged lesion right here from a biopsy earlier in the day. Other than that, everything looks good. She is dressed appropriately to the situation, and her demeanor is calm, and her facial expressions are appropriate to the situation. She is clean and well groomed, and she is well nourished, and her musculature is appropriate to gender and age. Her Snellen chart was previously assessed, and her vision is 20/20 in each eye, so there are no immediate vision impairments. Patient is not wearing any glasses, and she is maintaining appropriate eye contact with me. Her height and weight was previously assessed. She's 160 pounds and 5'4". And can you please tell me where we are?
We're at the doctor's office
And why are you here?
for a checkup.
And what season is it?
Fall.
Okay, and patient already told me her name, so she is alert and oriented ×4. There are no immediate hearing problems because she is able to hear all of my questions without having me repeat myself, and she's not showing any signs that she is having trouble hearing. There are no immediate speech problems either because she is responding to all of my questions with an appropriate speed, pitch, and tone of voice. Now, can you please tell me if you're having any pain on a scale from 0 being no pain, and then 10 being the worst pain you've ever felt?
0.
Okay, so patient's in no pain, so I'm going to move on to inspection of the head and face. Face is showing no signs of facial drooping. Eyes are symmetrical on the face, nose is midline on the face, and ears are symmetrical on the head. Skin color is appropriate to ethnicity. There are no abnormal nevi and no lesions on her face other than that one little biopsy that we talked about earlier. Her hair distribution is appropriate to gender and age. No visible signs of alopecia. I'm going to palpate your skull and your hair now, or your scalp. Okay, do you feel any tenderness?
No.
Okay, no tenderness on palpation, no depressions of the skull. Scalp moves easily along the skull. There is no presence of lice or dandruff and no lesions or abnormal nevi on the scalp. Hair distribution is full and hair is healthy, no brittleness, and no signs of alopecia. Now I'm going to palpate your TMJ. Please open and close your mouth. Okay, TMJ has full range of motion. Did you feel any tenderness?
No.
No tenderness and no clicks, pops, or crepitus on movement. Now I'm going to palpate your maxillary and frontal sinuses, so please tell me if you have any tenderness. Any tenderness?
No.
Okay, no tenderness on palpation of the sinuses. Now I am going to test cranial nerve 7, so please smile. Stick out your tongue. Puff out your cheeks. Good, cranial nerve 7 is intact. Now I'm going to test cranial nerve 5. Please close your eyes. I'm going to touch your face with a cotton wisp and tell me when you feel touch.
Yeah. 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 Yeah.
Okay, now I'm going to do the same thing with sharp and dull, so please close your eyes and tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull.
Okay, cranial nerve 5 is intact. To touch, touch, sharp, and dull sensation. Now I'm going to inspect your eyes. Okay, eyes are symmetrical bilaterally. There's no signs of eyelid drooping. There are no nodules on the eyes. There's no crust on her eyes. There's no excessive tearing from her lacrimal structures. Conjunctiva is clear and sclera is white. Now I'm going to test your pupillary response to light. So I'm going to go dim lights really quick. Please look straight forward at me as I shine this in your eyes. Okay, pupils have direct and consensual response to light. Cranial nerve 2 is intact. Now I'm going to test your corneal reflex, so please look right at me as I shine this between your eyes. Okay, pupils are symmetric. Cranial nerve 2 is intact. I'm going to go flip on the lights. Now I'm going to test your pupillary response to accommodation, so please look at my pen light way out here. Okay, good. Pupils are equal, round, and reactive to light and accommodation. Cranial nerve 2 is intact. Now I'm going to assess your extraocular movements. Please follow my pen light as I move it. Only follow with your eyes, don't move your face or your head. Extraocular movements are smooth and symmetrical. Cranial nerves 3, 4, and 6 are intact. Now I'm going to assess your visual fields. Please cover your right eye. Please tell me when you see my fingers come into your line of vision.
Now. 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 Now.
Okay, now other eye.
Now. 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 Now.
Okay, peripheral vision is intact and cranial nerve 2 is intact. Now I'm going to move on to the nose. So patient's nose is symmetrical on the face. Skin color is appropriate to ethnicity. There are no signs of septal deviation, no lesions on the nose. Now please tilt your head up. I'm going to look in your nostrils. Nostrils are symmetrical bilaterally. Nasal mucosa is pink and moist. There are no lesions or blood in the nose. Now I'm going to palpate. Do you feel any tenderness?
No.
No tenderness on palpation of the nose. And no deformities palpated on the nose. Now please plug one of your nostrils. Breathe in through your nose. Okay, other nose, or other nostril. Nares are patent bilaterally. Now I'm going to assess your ears. So patient's ears are symmetrical bilaterally. The pinna is in line with the corner of the eye. Skin color of the pinna is appropriate to ethnicity. There are no nodules on the pinna or no visible lesions, drainage, or blood coming from the auditory canals. And I'm going to look in your ears. Okay. Okay, cerumen and hair are visible in the auditory canals, but there is no abnormal lesions, blood, or drainage coming from the ears. Now I'm going to palpate. Do you feel any tenderness? No tenderness or nodules palpated on the ears. Now we're going to test your hearing. So please plug one of your ears and wiggle your finger. Please repeat back what I whisper. A, B, C.
A, B, C.
Good. Now other side.
1, 2, 3.
Good. Hearing is intact bilaterally. Cranial nerve 8 is intact. Now I'm going to inspect your mouth. Okay, patient's mouth is not drooping to either side. There is no lesions or chappedness around the mouth. Skin color is appropriate to ethnicity around the mouth. Please open your mouth, stick out your tongue. Now put your tongue up behind your... Good. Now to either side of your cheek. Okay, good. Buccal mucosa is pink and smooth and moist. Gums are pink and smooth with no inflammation. Patient has all of her own teeth. There are no lesions in the mouth. And now please lift your tongue up again so I can see the veins under your tongue. Veins are visible underneath the tongue. Good. Now I'm going to assess your oropharynx, so please open your mouth. I'm going to put my tongue to press right down. Good. Okay, there are no white patches or coating on the tongue. There are no white patches on the tonsils, no swelling of the tonsils. Tongue is midline, it is not deviating to either side, and there are no tremors on the tongue. Uvula is also midline. Now please open your mouth again and say ah.
Ah.
Okay, palate moves symmetrically and smoothly when she says ah. And cranial nerves 9, 10, and 12 are intact. Uvula is midline, no lesions or swelling in the mouth. So good. Now I'm going to move on to your neck. So on inspection, skin color of the neck is appropriate to ethnicity with no lesions or abnormal nevi on the neck. There is no obvious visible thyroid enlargement and no visible tracheal deviation. Now we're just going to do range of motion really quick, so please put your chin to your chest. Look up at the ceiling. Ears to each shoulder. Now look to each side. Big circle. Big circle. Now we're going to do it against strength, so look to either side. Good. Ear to shoulders. Okay, now down. Back. Neck has full range of motion and 5+ strength. Now I'm going to palpate your neck. Okay, on palpation, do you feel any tenderness?
No.
No tenderness on palpation. Trachea is midline. No tracheal tug. Can you please swallow? Okay, normal movement on swallowing. No nodules on the thyroid. Now I'm going to palpate your carotid arteries. Carotid arteries are 2+ bilaterally. Now I'm going to palpate your lymph nodes. Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and deep cervical, and supraclavicular. Do you feel any tenderness?
No.
No tenderness and no lymphadenopathy. Now I'm going to auscultate for carotid bruits with the bell of my stethoscope. Okay, no carotid bruits auscultated. Now I'm going to press down on your shoulders. When I press down, please do a shoulder shrug. Okay, cranial nerve 11 is intact. Now I'm going to move on to your upper extremities. So shoulders are symmetrical with one another bilaterally. Arms are of an even length bilaterally. Skin color is appropriate to ethnicity. There are no lesions or abnormal nevi on the arms. Musculature is appropriate to gender and age, and her fingernails are clean and well groomed. No signs of nail clubbing. Now I'm going to do cap refill. Good. Cap refill is under 3 seconds bilaterally, and on palpation, skin is warm and dry bilaterally. Do you feel any tenderness?
No.
No tenderness. Now I'm going to feel for your upper extremity arteries. So radial artery. Okay. Radial arteries are 2+ bilaterally. Now brachial. Okay. And brachial arteries are 2+ bilaterally. Now we're going to do range of motion. We'll start with your wrists and fingers. So put your hands out like this. Flex your wrists. Extend your wrists. Neutral. Put your fingers together. Fingers apart. Now neutral. Flip your hands over and then back. Okay. Now for your fingers, touch all your fingers together. Good. Now put your thumb to the base of your pinky. Good. Now stretch out all your fingers. Good. Now for strength, please grip my fingers. Okay, grip strength is 2 plus bilaterally. Now for wrist strength, put your hands out like this. Now press down with your wrists. Now extend with your wrists. And now put each of your fingers together. I'm going to tug on them. Good. Fingers and wrists have full range of motion and 5 plus strength bilaterally. Now we're going to do your upper extremity range of motion in your shoulders and your elbows. So please raise your arms above your head. Now down. Now hyperextend. Good. Now up like a jumping jack. And then down. And then internal and external rotation. So like this and then up. And then down. Okay, and then elbows out like this, bicep curl, and then down, and then against strength, we'll do it. We'll start with your elbows, bicep curl, down, good. Now go like this, lift shoulders up, press shoulders down, and then at your sides, lift shoulders up, press arms down. Okay, shoulders and elbows have full, oh no, we gotta do this one, so put your arms like this. Now rotate shoulders up, rotate shoulders down. Okay. Upper extremities, elbows and shoulders have full range of motion with 5 plus strength. Now I'm going to move on to your back. Okay, thorax of posterior view of the thorax is symmetrical. Respirations are of expected rhythm, rate, and depth. There are no signs of scoliosis, kyphosis, or lordosis. Shoulders are symmetrical bilaterally. Skin color is appropriate to ethnicity, no lesions or abnormal nevi. Now I'm going to palpate your skin. Skin is warm and dry bilaterally. I'm going to palpate your spine. Do you feel any tenderness?
No.
No tenderness on the spine, no signs of kyphosis, scoliosis, or lordosis. Now I'm going to palpate the scapula. Do you feel any tenderness?
No.
No tenderness on the scapula. Scapula are symmetrical bilaterally. And now I'm going to test for thoracic expansion. Please take a breath. Okay, patient has symmetrical thoracic expansion. Now I'm going to listen to your lung sounds posteriorly with the diaphragm, and then I'm going to listen anteriorly. Breathe in. Breathe. Okay, breath sounds are clear and vesicular posteriorly in all lobes. No adventitious breath sounds and no signs of labored breathing. Now I'm going to listen anteriorly. Once again, just take a breath. Okay, breath sounds are clear and vesicular anteriorly, no signs of labored breathing, and no adventitious breath sounds. Good. Now I'm going to have you lay down. Now I'm going to inspect your chest. So from an anterior view, thorax is symmetrical bilaterally, no signs of barrel chest. Skin color is appropriate to ethnicity. There are no lesions or abnormal nevi on the chest. Respirations are of expected rate, rhythm, and depth. And now I'm going to palpate your chest. Do you feel any tenderness?
No.
Okay, no tenderness on palpation of the chest. Now I'm going to palpate your precordium for the PMI. Okay, no heaves or thrills at the PMI. Now I'm going to listen to your heart sounds. I'm going to do this 3 times, once with my diaphragm and once with my bell, and then once when you're laying on your left side. I'm going to do this in a systematic way, listening from aortic, pulmonic, Erb's point, tricuspid, and then mitral. Okay, aortic, pulmonic, Erb's point, tricuspid, and then mitral. Okay, now I'm going to listen with the bell. S1 and S2 were present, no murmurs or auscultated. Now I'm going to do it again. Okay, Erb's point. Tricuspid. And mitral. Good, S1 and S2 are present. There are no abnormal heart sounds and no murmurs auscultated. Now please lean over to your left side to have the apex of your heart come closer to the chest wall, so it's easier to hear. Now I'm going to listen with my bell one more time. Okay, no murmurs or auscultated. Good. Okay, now I'm going to inspect your belly. Okay, skin color of the belly is appropriate to ethnicity. There are no abnormal lesions or nevi on the belly. There is no visible peristalsis and contour is flat. Now I'm going to auscultate your bowel sounds. With the diaphragm starting in the lower right quadrant. Okay, bowel sounds are present in all 4 quadrants. Now I'm going to palpate your belly, starting in the lower right quadrant. Do you feel any tenderness?
No.
Okay, no tenderness in the belly. Belly is flat, there's no rebound tenderness, no guarding, and no mass is palpated. Now I'm going to auscultate for aortic bruits or venous hums with the bell. Okay. No venous hums or aortic bruits are auscultated. Now I'm going to inspect your lower extremities. Okay, legs and feet are symmetrical length and size bilaterally. Musculature of the legs is appropriate to age and gender. Hair distribution on the legs is appropriate to gender. There are no abnormal lesions or nevi, and skin color is appropriate to ethnicity. I'm going to palpate your legs now. Skin is warm and dry on palpation on the legs and the feet. Do you feel any tenderness?
No.
Okay, now I'm going to palpate your hips for stability. Do you feel any tenderness?
No.
Okay, hips are stable with no tenderness. Now I'm going to palpate for edema. Okay, patient has no edema in the lower extremities. Now I'm going to feel for your lower extremity pulses, starting with the popliteal artery. going to do the posterior tibial artery. Okay. Popliteal arteries are 2+, or popliteal pulses are 2+ bilaterally, and posterior tibial arteries or pulses are 2+ bilaterally. And dorsalis pedis pulse. Good. Dorsalis pedis pulses are 2+ bilaterally. Now we're going to do range of motion of your ankles and toes, and then we'll do your hips and knees. So please wiggle your toes. Now please point your toe up and then down. Now please point your toes and then flex your feet. Good. Now please put your toes towards one another and then out. And then roll your ankles in and then roll your ankles out. Okay, now please press like you're pressing on the gas pedal. Good. And then back. Okay, ankles and toes have full range of motion and 5+ strength bilaterally. Now we're going to do your hip and knee range of motion. So please lift one of your legs up, pull your knee to your chest. Okay, good, and then flatten it. Now bend one of your knees with your foot flat and rotate your hip in, rotate your hip out, and then back neutral flat. Now take your leg away from your body and then over across your other leg. Good. Now let's do that with the other leg. So please lift your leg up, knee to chest, and then extend flat. Good. Now put your foot flat next to your knee, rotate your hip in, rotate your hip out, and then back flat. Then put your leg away from your body, and then over your other leg. Good. Now we're going to do that all against strength. So lift leg up, lift leg up. Okay. Now lift leg up, press down. Press down with your hips first. Good. Now we'll do it with this one. Press down with your hips. Okay, now bend your knee. Now press down with your knee. Press up with your knee. Good. Press down with your knee. And then up with your knee. And then put your foot flat. Now rotate hip out. Rotate hip in. Good. Rotate hip in. Rotate hip out. Good. Okay. Now let's do, now put your leg away from your body and then towards your body. Good. Away from your body. Towards your body. Good. Hips and knees have full range of motion and 5+ strength. Now please sit up for me. Patient is able to sit up with ease of movement. Now we're actually going to go over to the other side so this camera can catch all the footage. Okay. Okay, I'm going to test the sensations of your upper and lower extremities, so please close your eyes and please tell me if you feel sharp or dull sensation. Sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull. Okay, good. Sensations are felt in the upper extremities. Patient is able to identify between sharp and dull. Now, I am going to test your fine and gross motor function and random alternating movements. So, can you please touch all of your fingers to your thumb? Now do it as fast as you can. Good. Now put your arms out and point your fingers, touch your nose, and then other hand. Now as fast as you can. Good. Now put your hands on your thighs, flip them up and down, fast as you can. Okay, good. Random alternating motions, fine and gross motor function are intact. Now we're going to test stereognosis, so put your hands out and close your eyes. I'm going to place something in your hand. Please identify what it is without looking at it.
Key.
Good, stereognosis is intact. Now I'm going to test your patellar reflexes. Please dangle your legs as I tap your knee. Good. Okay, patellar reflexes are 2+ bilaterally. Now I'm going to test your balance with the Romberg test, so please stand up. Let me see if we can see you. Okay, how about come stand over here? Okay, please stand with your hands at your side and your feet together and your eyes closed. Good, now open your eyes and shoulder width apart of your feet. Now I'm gonna push you a little bit. Please recorrect your stance. Good, now stand on one foot with your eyes closed. Okay, good, now other foot. Okay, good. Now hop up and down on one foot with your eyes closed. Okay, good. Okay, other foot. Good job. Okay, Romberg negative, balance is intact. Now please go stand by that white door. Now please walk normally over to me and then turn around and walk back to the door. Good, now walk back to me, walking heel to toe. Good, now walk backwards, heel to toe. Okay, patient's gait is smooth and symmetrical, and her strides are also smooth and symmetrical. She has even movements while walking, so that's great. I am done with my head to toe assessment. Do you have any questions?
Nope.
Okay, thank you. We're all done.
Thank you.